perpendicular needle placement. Center the probe directly on top of the target. Check the distance from the skin to the target in order to judge the appropriate needle angle to use. For superficial targets, the needle will be placed with a flatter angle, and for deeper targets, the needle will be placed with a steeper angle. Note that most probes have an indication of the center point on the long side, which is helpful for optimal placement of the needle. Make sure to allow at least 1 centimeter distance between the edge of the probe and the needle entry to allow space to change angle as needed in order to reach the target. Place local anesthesia accordingly before starting sampling. Pay close attention to where the needle appears on the screen as it crosses the field. If you see the needle appear above the target, you need to pull back and reposition the needle with a steeper angle. Or if the needle is coming across the field below the target, pull back and adjust to a flatter angle until you see the needle crossing the field inside the target. At this point, start the sampling with to and fro motions tailored to the size of the target. The needle is only visible as a point on the screen as it travels across the field of vision. Advantages of perpendicular needle placement include a shorter distance from the skin surface to the target and more flexibility in getting into tight spaces limited by adjacent structures such as large vessels and bone. The main downside is the lack of visibility of the needle until it crosses the ultrasound field.